Welcome to the Deep Dive. We're here to take your sources, your research, our notes, and really boil them down to what matters most. Today, we're tackling something huge, making zero avoidable harm to patients, a state of mind, and a rule of engagement in healthcare everywhere. Now, this isn't just some, pie-in-the-sky idea. It's meant to be a tangible goal. It affects your safety, your trust, whenever you interact with healthcare.
Exactly. And we're digging into a global report today. It gives us a snapshot, really, of the progress, but also, frankly, the challenges in making this zero-harm idea stick. We're looking specifically at what countries are actually doing strategically, or maybe what they aren't doing.
Okay, so let's unpack that. Zero harm. It's a philosophy, right? A guide for healthcare. What's the global commitment level looking like, according to this report? Are countries really buying in?
Well, it's interesting. There's a bit of a disconnect. You see, most countries, about 55%, they do recognize patient safety as a national health priority. It's explicitly stated.
Yeah.
But there's a real gap when it comes to operationalizing that, putting it into action. Like only about a third of countries have properly woven patient safety into their national plans for universal health coverage, UHC.
Only a third. Wow.
Yeah, and that's despite the fact that, reducing harm obviously saves lives, but it also frees up resources, builds public trust. Both are absolutely vital for UHC to work.
Right. So recognition's there, but the follow-through, maybe not so much yet.
Right.
What's the main roadblock? Is it like resources, money, people?
Resources are definitely a major piece of this puzzle. The report is quite clear. Only 11% of countries say they have adequate financial and human resources to actually implement these safety strategies.
Is it 11%?
11%. And what's really striking is that this isn't just a low-income country problem. It's universal. It doesn't matter if the country is rich or poor.
That is fascinating. So it suggests maybe it's less about the amount of resource available overall and more about how it's prioritized globally, like a shared blind spot.
That's a good way to put it. Yeah, a shared blind spot when it comes to actually funding patient safety properly.
Okay, so with those resource challenges, what about the rules, the laws?
Yeah.
Are the basic legal protections for patients in place?
Here, the picture is a bit brighter, thankfully. We see stronger numbers. About 72% of countries have laws for mandatory licensing of healthcare facilities. And 79% have laws for authorizing medical products. So, the basic framework is often there.
Okay, that's good.
The foundation. It is a foundation. But, and this is a big but, what about protecting the people who actually see the problems, the frontline staff? Only 19% of countries have laws that protect health workers from being punished for reporting safety incidents.
Wait, only 19%?
19, yeah.
That seems incredibly low. How can you possibly build a safe system if people are scared to report errors? That feels like a fundamental flaw.
It really is. Imagine being that nurse, that doctor. You see something, maybe a near miss. If reporting it puts your job on the line,
Yeah.
then that vital information, that chance to fix the system, it just gets lost.
That's a really powerful point.
No.
Okay, let's shift gears slightly. Is there better news on, say, global awareness, getting the word out, driving specific initiatives?
Ah, yes. This is actually a huge success story highlighted in the report. World Patient Safety Day. It only started in 2019, but it's generated incredible international momentum. You've got 80% of member states actively taking part in the annual campaigns, often with top leaders involved, doing really visible things like lighting up national monuments in orange.
Oh, I remember seeing pictures of that. Lots of orange landmarks.
Exactly. Over 400 monuments globally back in 2022. It really grabs attention.
And what about those big WHO campaigns like Clean Care is Safer Care or the medication safety one, Medication Without Harm? Are those translating into action?
They definitely seem to be. These challenges target really critical, high-risk areas. The report shows almost 90% of countries are tackling at least one of them, and 31% have actually implemented all three main challenges. That number's been climbing, showing growing engagement. Plus, you see countries like Kenya and India developing their own detailed national plans, bringing different groups together. It shows that tailored national efforts combined with global pushes can work.
Okay, so wrapping this deep dive up, what's the big picture for you, our listener? We're seeing a global nod towards zero harm, real progress on awareness, some solid regulations, but also these really persistent gaps in funding and resources, and crucially in creating that culture where reporting an error is safe, where it leads to learning.
That's right. We're definitely on a journey. Zero harm isn't just a target you hit, it's a mindset, a philosophy. If you graded the progress on strategic objectives from the report, it's maybe around a 60 out of 100, so moderate progress. But the path forward seems clear. It needs continued policy work, serious investment, much stronger laws to protect reporters, better standards, and keeping that global awareness high.
It really makes you think, doesn't it?
Hmm.
As patients, as citizens, what's our role in pushing for this? For zero avoidable harm right here in our own communities? What questions might you ask next time you interact with the health system now that you've heard this?